Hi, I'm Kim McCarl, the Communications Officer for Contra Costa Health Services. Our department has been fielding many questions since we announced the extension of the shelter in place through the end of May. I'm here with Dr. Chris Farnitano, who's the Health Officer for Contra Costa County, to talk about a variety of topics that people have been asking about. So one of the things that you and the other health officers in the Bay Area have done is identify some indicators that you'll use to track our progress, because we feel like we want our decisions to be based on science and we want to be able to watch the trends. That's an important part of understanding how well we're doing in terms of minimizing the impact of COVID. Tell us a little bit about how all the health officers settled on these 5 indicators.
Well, these indicators really were similar to the governor's plan for reopening the economy, but we felt we wanted to really put some hard numbers on them. And those numbers are based on a lot of expert opinion as to what is really needed to be sure that we're not going to have a surge and that we are prepared for any surges in cases that might happen.
So let's walk through them one by one. The first is total number of cases in the community is flat or decreasing, and the number of hospitalized patients is flat or decreasing.
Those 2 numbers are really important because if we're seeing a surge in cases, especially if we see the number of hospital patients going up, we know that that's a danger sign and the hospitals could potentially be overwhelmed. We want to make sure that the number of patients in the hospital is 50% or less of the total number of hospital beds. And also in the ICU, it's 50% or less of the ICU beds, and it's flat or decreasing, because we need also those hospitals to take care of all the other things they take care of, whether it's heart attacks or cancer treatment or elective surgeries. And so the hospitals need some capacity for those things as well, and not to be totally overwhelmed with just taking care of COVID-19 patients.
And are we moving in the right direction?
Yes, we are. In Contra Costa County, our hospital numbers have been declining, and our number of new cases per day has been declining, even as we are increasing the number of tests we are doing each day.
So the second indicator is sufficient hospital capacity to meet the needs of our residents. How are we doing there?
Well, we're doing pretty well right now, but we want to make sure that our hospitals are prepared and they're not overwhelmed by the sheer numbers of cases that come into the hospital. We want to reserve at least 50% of our bed capacity and our ICU capacity for non-COVID patients. And we want to make sure we can treat patients in a proper way. So we want to treat patients in a real ICU, not some sort of emergency ICU that we create because our regular ICU is totally overwhelmed with patients.
So the third indicator is around testing. And right now we're doing somewhere between 300 and 500 tests a day, which is not really where we want to be. We want to be a much higher number. How many tests per day do we want to do? And why is that such an important indicator?
We really want to do about 2,000 tests a day, and that's enough so that not only will we be testing almost everyone who has symptoms of COVID-19, we're testing a lot of high-risk people who may not have symptoms and picking up a lot of those asymptomatic cases. The idea is if we can pick up most cases, identify most cases, then we have the ability to isolate those individuals and prevent further spread of this virus.
So this is a shift in what we've been telling people. You no longer need a doctor referral. You no longer need symptoms in order to go and get tested. Is that true?
That is true. You don't need a doctor referral. You don't need symptoms. Anyone who wants a test can get a test. And the idea is the more testing we do, the more we find. And if we can identify cases, then people have that information so they know how to separate themselves from other individuals and prevent the spread. And it's all about preventing the spread.
So we really encourage you to look at our website at cchealth.org for information about testing, and to call the number on the screen if you'd like to set up an appointment for yourself. So the fourth indicator is around sufficient case investigation and contact tracing. What is contact tracing?
Contact tracing is a traditional public health function that we've always done, but we've never done it on this scale. So it's identifying someone with an illness and then identifying the people who've been in close contact with them. We do this for tuberculosis, we do this for measles, and now we're doing it for COVID-19. We want to identify everyone who's been within close contact of that individual, might have been exposed, and that includes household members, it includes folks they may be working with, it involves people they may have come into close contact with out in the community.
And how does it help protect me?
So by identifying those close contacts, we can instruct them to isolate themselves, keep themselves away from retail stores, stay home from work, so that they're not continuing to spread this virus. We know now that many people can spread the virus before they develop symptoms, and some spread the virus and never develop symptoms at all. So by isolating those folks, we can stop that spread.
And how will we know that we're making progress on this indicator?
So we are measuring how many people we are reaching as far as positive cases, and we're also measuring how many of their close contacts we are reaching. And our goal is to reach at least 90% of cases and to reach 90% of their close contacts.
So the last indicator is around personal protective equipment, PPE. And the indicator says that we need to have at least a 30-day supply. I want to just note that our community has been incredibly gracious in terms of donating PPE, and it really has made a difference. But how are we doing with PPE supply, and how long will it take us to get to a 30-day supply?
Well, we're doing much better. We're still having shortages, and we're still getting requests to our Emergency Operations Center from healthcare providers to supply them with additional PPE. We're able to honor most of those requests, but often we're only able to give a week's supply instead of a 30-day supply. So the supply is getting better, and we're hoping within the next few weeks we can get to the point where all our healthcare providers have a 30-day supply of PPE, personal protective equipment, on hand.
We want to thank Dr. Farnitano for being here today to help us understand these questions. There's a huge amount of information available on our website at cchealth.org, and we update it constantly. We really encourage you to spend some time there looking at our frequently asked questions, and then also to let us know what questions you have so we can do a better job of making sure that whatever information you need is included on our website.